Executive Officer, Community Health Centers, joining us in the K-Wave News Zoom room. Good morning, ladies.
Good morning.
Let's just thanks for joining us. And I know we want to talk about the village vaccination and everything that's going on with that effort, but we really kind of wanted to first start with maybe asking you guys to kind of reflect on the last year, maybe go over some of the key points for you guys, as you guys are, frontliners, obviously, on the front lines of responding to this pandemic. And so I know that you were right here along with us. I think we've had just almost all of you guys on the show, except for maybe Miss Kat. But, we shared a lot of moments together during this coronavirus pandemic. So I guess we'll start with you, Dr. Suzanne, just looking back, your thoughts on the last year under COVID.
So when the COVID response started, we started testing all the residents in all the various villages, right? So we progressed from testing. Now we're down to vaccination. So this is probably the end already of our journey. So hopefully that will go back to normal after everybody got vaccinated and go back to normal. So it's actually been almost over a year already since we started this response. So I'm hoping that we get everybody vaccinated by maybe June or July, so we can go back to normal, open up the island again, and see the tourists back. So we're just hoping. That's what we're trying. That's why we're trying so hard to do our vaccination outreaches, so people can have the opportunity to get vaccination. So we're giving all the opportunity to get vaccinated. We offer it at the EOG. Now we're going to the villages. We're going homebound. So it's a great effort on our nurses that they're doing this. So I'm really thankful that of all the nurses at Public Health and GDOE, EOG, GCC. So it's an effort. So it's a great collaboration with all the nurses on that. So I'm very grateful for that, and I appreciate that.
And so, what about you, Kat? As you look back at the past year?
So I actually was reflecting with one of our nurses from the beginning. We were saying, oh, we can't wait for the vaccines to come in. It's going to take a year, and I can't believe we're here now. So in the recovery phase, all the nurses, I really thank them for their efforts, and the staff as well as the rest of the community. It really takes a team effort to get here at this point. So it's a really...
Sorry, go ahead.
I was just saying, it's really like it took a big effort and support for the rest of the team to get to this point now.
And Leanne?
Last year was like the longest year ever. It was like being in the Twilight Zone or something.
Right.
But reflecting, it is amazing how far we've come. From remembering back when the roads were so empty, everyone was on lockdown, talking about what it's going to take to overcome this pandemic, and now coming to where we're at now with heading out there, getting people vaccinated. It's surreal, I'm glad we're here now. I'm glad that we're trying to get everybody vaccinated. I know a lot of people are asking, when is it going to be their turn? We started 40-year-old and up yesterday, and that's a start to getting into our younger people. So like Dr. Kaneshiro said, hopefully by June, July, everybody will be vaccinated.
Mm-hmm. And so where are you guys at today?
Today we are down at the Agate Gym. We'll be doing vaccinations here for both first and second doses using Pfizer. We'll be here starting at 9 o'clock until 3 p.m. or until supplies last.
And I gotta ask, public health, aside from, everybody knows you guys are frontline. You have been working nonstop through this COVID response. But sometimes, people, you take criticism from people, and sometimes it's not so nice, right? And I just want to know, what kept you going through all of that noise and doing what you got to do every single day. Dr. K, I know you've made some tough decisions. You've been on this show, and you've had to make, like I said, those tough decisions with people, who wanted to get out of quarantine, but they couldn't, especially in funeral type situations. And I think you were on. We had somebody on, and I think it even had to go to court.
So, the aim is to keep people healthy, okay? So if we have to quarantine people, we will quarantine people for the sake of everybody else on the island, right? So we hear the criticism, but it's still our goal is to get this island back to normal while everybody stays safe, healthy, right? That's our goal. So it doesn't matter what the criticism is, but our goal is to keep people healthy. So even if they criticize us for, why do I have to quarantine? I've been vaccinated. I have a negative shot. It doesn't matter. Yeah. The goal is to keep everybody healthy. So we take the criticism, but that's our goal. We're not gonna listen to everybody. We'll just take it as part of the job, right? And so we have to do what we have to do. In the direction of the governor and the director, that's what we're going to do.
Right. We thank you for what you do, good or bad, or just whatever you hear. Kat, I saw you shaking your head like, yeah, huh?
Yes. Well, because of course, I just see the looks of the nurses. I won't stop because I see their efforts, their dedication, their hard work. So just seeing their faces, that they're here to help the community, help prevent the spread, and of course the vaccination efforts. That's what keeps me going. Just seeing my colleagues keep going on and not stop, even though we work sometimes late at night, having late meetings. Also, again, early morning testing, whatever that needs to be done since the beginning.
And what about you, Leanne? What's kind of kept you going? What's been your motivation throughout this whole thing? Because this has definitely been a tough time for all of you frontliners.
Kat is absolutely right. It makes it so much easier to go into work when you work with great people, and we are blessed to have a great team in collaboration with the GDOE nurses. They have been amazing throughout this whole year in helping us. I don't think we'd be able to get through the year the way we did without them. And so I'm truly grateful for our GDOE nurses. At the same time, even though we hear the criticism, we go home at the end of the day, we're frustrated, tired, but the next morning we got to push on because we really do need to get our island back up and running like normal. So that drive to just get to normal pushes all that criticism down. And you know what? Sometimes criticism fuels you. People can talk negatively, but you take that and you learn from it, you move on. If you have to ignore it because they just don't know what they're talking about, then you do that. We gotta get out there. It's not easy doing what we do. People think that all we do is get out there and take direction, but it's more than that. It takes a lot of drive, a lot of perseverance, and that's why we're here. That's why we became nurses.
And we appreciate everything.
I'm very proud of the nurses. I'm very proud of these nurses. They work hard every single day. Whatever is asked of them, they do it. They have to go to the QFAC on Sundays. We do the testing on Saturdays, evenings. They do it. I'm very proud of these nurses. All the nurses from public health and the DOE, UOG, GCP. I'm very proud of these nurses.
Right. I mean, there would be no response without our nurses. We wouldn't be where we are. So thank you guys so much. And so if you want, just maybe some words to encourage people, because you're right, we just expanded the eligibility to 40 years and over. Your words of advice and encouragement for people to come out and get vaccinated, because it's not over yet.
So we're trying to make it convenient for people. So we offer at different places. We go out to the villages. We do the homebound. So if you're homebound, just contact your mayors and we will get to you, right? And so we're trying to make it so convenient for you to get vaccinated. There's really no excuse not to get vaccinated, you know. So we're hoping that they come out. Today we're at the Agate Gym, like Leanne said. And so the people in Agate or to other surrounding villages can come out. We're there until supplies last, like Leanne said.
Yes. I know a lot of people are still scared to get the vaccine. And as a nurse, I want to say that I myself in the beginning was scared. This is a new thing. It usually takes decades for a vaccination to be produced. And we did this in a year, but this is how everything starts. Back when the flu first came along and they first came out with the flu vaccine, this was the process that they started out with. So we got to remember we have to start somewhere. The benefits far outweigh the risk. Just remember that, okay? We'd rather be able to have our body recognize and fight the virus than to be foreign to us, and we go through all that so many people have gone through last year in fighting it, and sadly, some who didn't get to survive that.
You lost.
Oh yeah, we love. Kat, could you want to have any advice?
Oh yes, of course. Again, the efforts. Everyone, as long as they get their vaccine, for those who are eligible, please do. It does, like Leanne said, it does. The benefits outweigh the risk.
All right. Well, thank you, ladies.
Thank you, Doc. Thank you, Kat. It's always been a pleasure having you guys on, and appreciate your perspective looking back at this pandemic, and hope the way forward's much more positive, and it's already looking that way.
So sorry.
Oh, that's
Sorry
good.
about that. My team members just arrived at the gym, so they're looking for me. But again, like I was saying, I know we're all scared. I was scared to begin with, but I eventually realized that we do need to get it. So get out there, get the vaccine so that we can all get back to normal.
Okay.
Thank you,
Jen,
ladies.
thank you.
So
Thank
sorry.
you.
Thank you, Doc. There you go. Department of Public
Stay safe.
Health.
Good luck today.
Go wash your hands.
We're still saying that.
Yeah, we're
We're
still
still
saying
saying
that.
that.
Yeah.
And just remember, even though you're vaccinated, you shouldn't let your guard down. We still have to be vigilant. We are our first line of defense, okay? So it starts with yourself. It starts with us. Always remember, you still need to wash your hands, use hand sanitizer. If you're out in public, we don't know who have gotten the vaccine, so continue to wear your mask and stay 6 feet apart.
Thank you, Leanne.
Okay, thanks.
Thank you, Kat. Thank you, Doc.
Thank
Wipes
you.
up, wipes
Wipes up. Thank you. Right on 823. The
Go
link.
get him today.
The link continues next, right here on Facebook Live, KUAM News, Facebook Live. Simon comments, great interviews this morning. God bless our frontliners for helping us protect our families and
Yes.
friends. Keep up the good, dedicated work. Never let our differences divide us.
There was a comment here. I think it was a Joy.
Joy Rivera Woodward had commented.
Yeah, as we pay tribute to the anniversary of the pandemic, I also want to give thanks to the grocery stores for staying open.
Yes.
Just a suggestion to have representatives share their pandemic experiences, deciding to stay open.
That's
Right.
a great point.
Not
Yeah.
just the grocery store workers, the
Gas
gas
station
Gas
workers.
stations.
Yeah.
Oh, man.
The security guards, the,
Right.
the people who take your temperature when you first walk in,
Right on.
the stock clerks in the back.
Restaurant workers.
Let me share a little something because my son was a frontline grocery store essential worker, and he would just tell me some of the things that they would see. I mean, and more on the tail end of the pandemic. But you know, he's really fortunate to it's like his first real job working at Payless, and so for a little while he was the kid who would like the mask checker.
Mm-hmm.
You know what I mean? So he would just tell me that some people, you always have those one or two people who just don't want to wear the mask, but for the most part, everybody was just kind of on the same page, and it was like a family there at the store, because like the public health nurses, they felt like they're going into this pandemic. It's a team thing. They're all in it together. providing, you know, essential services. I mean, pandemic or not, people got to eat, and you know they got to eat stuff that they get from the grocery store. So I always valued my boys' perspective, and just going around shopping, you would see that. I mean, these grocery store workers, a lot of times, yeah, maybe they were scared too, but you know they still had to work. I mean, we had worries and fears, but you know everyone's got a job to do, and that's one thing I think we need to appreciate. Everyone who kept working during this pandemic, who kept this island running. You know what I mean? Because there was a lot of things that just never stopped going.
And actually,
GPA, GWA,
Right, yeah.
Guam Solid Waste. Oh goodness.
firefighters, EMTs, police officers, and I do have a special shout out because as Chris was mentioning that, you know, remember how when everybody was flocking to the stores before the pandemic was officially like a thing, when we had that temporary scare about, you know, you couldn't find hand sanitizer, hand soap was becoming less and less available, and toilet paper not so much, not as bad as in the States, thank goodness. But I want to give a special shout out to one of the first people that we interviewed maybe about a week into the pandemic. Nestor had a interview with our friend Bernie Valencia over at Matson. And
Yes, Bernie.
And when they said, they were like, yes, there is a shipment coming in, 2 days, we're going to get all the supplies off. We have hand sanitizer, we have soap and everything like that. We're looking out for you guys too. And Bernie has been a fantastic leader at that company too.
We're going to take a quick break, and we're back with more of The Link next. Good morning.
Catch a wave of fish and